Good morning. I would like to extend a warm welcome to everyone on this very cold morning. And I would like to acknowledge certain individuals in the room, Dean Snezik, um, Dean of Business, Dr. Summersall, Vice President at Montgomery College, Roger Ford, Executive Director of Accenture, as well as the distinguished judges, Jessica Long, Ricarda Ganjam, and Latisha Roberson. I would also like to extend a warm welcome and to acknowledge the students who worked so hard throughout the semester. Now, I know everyone is probably very nervous and excited, so I'm not going to prolong my remarks any further. I would like to welcome Roger Ford from Accenture to give a brief address. Thank you.
Okay. Thank you, Professor Foster. I just wanted to say that this has been a very exciting initiative for Accenture to partner with Montgomery College and present the first ever strategy case study around international development. The thing that makes this particularly unique is that this case is one of the top cases that we provide to our strategy candidates inside Accenture. And to see the students here at Montgomery College take on this challenge and present and develop such impactful and innovative case examples and presentations really is exciting for us at Accenture. I think moving forward, we'll have the opportunity to expand this program, and I look forward to working with Dr. Summersall and Dr. Snezik on doing that through other Montgomery College campuses and to other classes. So again, Accenture is very appreciative of this opportunity and very excited to hear the cases today. Thank you.
Thank you. Now, on behalf of the students, I have Atara Mark, who would like to make a brief introduction. Atara?
Welcome, everyone. So at the beginning of the semester, I was told that along with balancing a full course load, I would also have to help solve the problems of a developing country. And I was like, oh, that does seem sort of intimidating and almost like a Herculean task. But after hours of researching and reworking issue trees, and I don't know how many drafts we went through for our presentation, but we did it. And I'm proud to say that everyone in this room has worked really hard on their presentation and finding a way to solve a problem in Ghana. So good luck, students, and I'm really excited to see everyone's presentation.
Thank you. Well, not to prolong it anymore, let the games begin. Competition is on. We have the first group who will be talking about empowering women in Ghana through cocoa farming. Paula?
Good morning, everyone. My name is Paola Zuniga. These are my group mates.
Ryan Robinson. Arnaldo.
Jonas.
And we are here to ask for smartphones for the female farmers in Ghana. More and more smallholder farmers are now harnessing the power of the telephone to help them connect to agricultural services, informations, and markets. But the uptake is slow in rural Ghana, so we must jumpstart the cause. To do so, we must focus on the female cash crop farmers, who make up half of the agricultural labor force. By focusing on them, we empower them with new technology that will provide them with the latest tools, diminish the mobile gender gap, as well as new means to better provide for their families. However, there are complications. There is lack of the smarter phone in Ghana that's accessible to the rural farmer. And there's barely training and infrastructure available to teach the current tech illiterate women. So along the way, by providing smarter phone technology to the rural female farmer in Ghana, cash crop production will increase. Jonas will explain how.
Alright, so for our project, we broke it down to 3 specific phases. Phase 1 is about 5 months long, and phase 1 is how we request college students to make an application that will help these female farmers with their smartphones in order to see weather patterns within the area, in order to get mobile banking, so that they'll be able to see their money, see when the best time is to crop the cocoa plant. An incentive for these college students is that the winner gets a stipend, whoever creates the best application that is available. We will also be using resources from our partners to gain insight. We will also be using resources from our partners to gain insight of other apps that are being used currently in different countries, in other developing countries that are targeting the same thing that we are. Phase 2 is about 2 to 4 weeks long. We provide female farmers with a training hub that will be rented out to the NGO. And then we would transport those female farmers to the training hub in order to train them about how to use the smartphones, how to access the application, how to utilize all these features. Phase 3 is an ongoing phase after it is started. Female farmers will take the phones home and they'll begin their production on the cocoa plant, gain knowledge on the farm productivity, and also gain resources that weren't accessible before the application was created, such as the banking application. If these farmers do want a daily update, they'll be able to get it from our NGO hub, where Wi-Fi will be provided and updates will be given to them. As you can see here is how we broke down the cost. The NGO rental space will be about $100 to $500 per month for 60 months, which will be from $6,000 to $30,000. The phone cost will be $500 per farm, or 500 farmers and $100 per farmer. And the Wi-Fi cost at hubs is $100 per month for 60 months. Salaries for trainers are 4 trainers at $500 per month, and the transportation is $1,000 for 4 different buses to transport these individuals from their area to here. The gas cost will be about $300 a week for 260 weeks, all ranging in a total cost of approximately $293,000. Our revenue is revenue that these partners can gain from this is that they will have a new target audience to provide their resources to, such as the cell phone companies, the applications. Also, we will provide advertisement on these applications, which will be best used from the farmers. If they see advertisement that they want to use, click on the advertisement, take you there.
We found that our solution benefited both the female farmers and the community that surrounded them, indirectly and directly. If we look here, female farmers, they benefit because they have the opportunity to be breadwinners in their families because of the added income brought from this app. And we will be able to incorporate the new era of technology in the farming industry in Ghana and provide global things to the farmers, such as market prices and weather conditions, which will greatly help them. Indirectly, it will diminish the mobile gap because in Ghana, there's a greater use of mobile technology with men than women. And also, we'll put some financing tools in there so they can transfer some money. And with this, their children will benefit also in the future because the information they know now, they'll teach to their kids, and then it'll improve everything. With the community directly, it will make them more efficient, and this will help the community overall. And access to these new applications will open up the job market because they'll be in a different sector. And also the implementation of this will create more awareness in different fields so they could actually branch out more create a better impact. And also allow them to transition from a cash economy to an electronic economy, which would be much more safer and efficient. I'd like to pass it over to Simone.
Like Brian said, one of the biggest impact for our application is to really empower the to empower female farmers, and for us is like to let them having more access to mobile phone and appropriate tools, so then they can increase their production.
As for the feasibility, mobile technology with SMS texting is blooming, so mobile technology with interface is the next step. Since it is already available and proven to be easy to learn, it will be feasible. Applications already exist. There's thermal aid here in the United States that can be taken over to Africa. There's M-Pesa, which is a microfinancing technology used by Kenya for easy transfer of money. There's also an application that was created by the NGO Planet Finance, which is specifically for interface smartphones. And what they do is they scan barcodes of the sacks of shea nuts, and they receive market prices from them. And most farmers already actively use media sources to improve their crop production. So the acceptance of the technology is already there, and it's already successful.
When it comes to the scalability, the most important is to create more jobs for, like in the U.S., especially in the technological sector, and also it will increase the household income.
For the farmers, we're asking to, well, for the partners that we're calling upon is Accenture, because we're trying to get you guys to give us access to your resources, which is the Bill Gates and Melinda Gates Foundation, and the U.S. aid for funding. We're asking for the Better Than Cash Alliance, access to access to the BTCA resources to create the applications and the smartphones that will work to adopt the use of electronic payments and the life of female farmers in Ghana. For the GSMA Development Fund, we're asking to work with the Migree resource to develop new applications, especially tailored towards the rural farmers in Ghana. As for MTN, in additional to providing the less expensive smartphones at the lowest price, we will work with them to make sure that the internet connectivity is is where I'm sorry. All right, to make sure that internet connectivity is everywhere in rural Ghana, so updates are more accessible. As for the CCAF PAR, which is the Climate Change Agriculture of Food and Food Security part. Oh my God.
Okay, keep going. Participatory.
Oh man, I'm so sorry right now. Participatory action research. They form the activities that work through the learning loops to building a knowledge and share lessons learned with policymakers and local communities. As for RAINS, which is a NGO that will support women with easy access to microloans because the organization strives to improve the quality of women in Ghana.
Do you have any questions for us?
Thank you very much for that presentation. And for the ask, I assume the ask from us is somewhere the total of the $293,000 for the pilot, is that right? For the 500 farmers, so about $600 or so per farmer for the pilot. So if I pay for this initial phase, to roll this out, which I assume is everything you mentioned, the cost of the smartphones, the application, and the transportation, as well as the internet access. What's your business plan for the ongoing payment of these solutions, as well as the scaling up? So, because since you're only impacting 500 farmers, I assume you want to impact millions. If I pay for this initial pilot, how will you fund the rest of the scale up?
I believe that the way that we had planned on it was that by having these test farmers, such as these 500 farmers, it would be like you get them to accept our ways of cropping, our ways of doing things with the smartphones, and then other farmers would want to join into it, and it'd be more of a give back type program. And also, like, we plan on having not just the 297,000 or 93,000 from Accenture. We plan on having a little bit extra funds to be in the farmers, like, I don't know how to explain, in like a bank for the farmers specifically, so that it will help them within the coming years, so that at a certain point they can just, at a point of like 2 to 5 years, they can be able to just fund themselves.
So after the initial 500, new farmers would pay for this service?
Yes.
Okay. Any other?
Yeah, just one question. Do you have any evidence to back this up as far as, have you come up with any type of examples in a laboratory or any type of criteria that you are, that you're able to back up the cost of this project and the expected results?
There was just simply research done on all the phone cost and the training, and we did the maximum it might cost.
Mm-hmm.
But most of the research that was done was based on already the agricultural market and labor force that's already out there for the smartphones. It's already existing.
Okay, great, thank you.
What do you view as the biggest risks to your project?
One of the risks we view is farmers probably not accepting this, which is why we would want to provide the transportation cost so that they have more motivation to go to the training hub in order to update.
Another risk that we have recently found out about is that the cocoa plant is endangered. It's expected to be extinct by the year, I believe, 2016. So we want to get as much production of the cocoa plant as possible within those years, and somehow try to at least extend that extinction to a couple more years.
Another possible risk is in Ghana, a lot of the males are mistrustful of the females having phones. So another possible risk is they won't allow the females to use these phones. That would, of course, render the whole app useless. That was a big risk right there.
Thank you.
Thank you.
Thank you very much. The next two teams they believe they have the solution for reducing the number of dropouts in high school in Ghana. So the next team is Michaela, and the team after that is Colin, and they both believe they have that solution. Thank you.
Okay, we are almost ready. Good morning, everyone. My name is Jaime Reyes, and this is my group. We're gonna be we're gonna do a presentation in improving education and providing extra help to middle school students in Ghana. So,
My name is Osley. So just go ahead and pay attention to our group. I'm gonna let Michelle take it away.
Good morning, everybody. My name is Michelle. Oh,
Good morning. My name is Keon Johnson.
I want you to ask the question for yourself. How would this country be if the dropout rates of secondary school students are high? Just think for that for a moment. Our goal is to improve education in Ghana, and that we will work in the district of the Adima Avram Plains. We found that students' dropouts are extremely high, and for those students who are about to go to high school. So with our project, e-learning will make the education more convenient, and our project is also self-sustainable. Now, I just want to show you, we have a graph here from the year 2007 up to the year 2012. As you can see, the dropout rate is extremely high. There's about 1.7 million people in the secondary schools. And as you can see, the territory level for those students who reach the territory level is about 30.1%. Now, with our project we worked on, we will decrease that or increase the education level up to 100%. And this is how we're going to do it.
So basically, what we want to do is that we want to work with high school students because we want to work with high school students. We want a teacher to help them to record videos. We want to upload these videos to a website where middle school students can go to and they can use search for extra help or go back and review the session that they just had. Because there are a lot of students, teachers, they don't have time to go over everything. So basically, some students may get lost in the middle of the class and they're not able to ask questions because there are too many students and they cannot be answering so many questions. So as we can see here, we want to record some homework samples. We also want to record the class session. If a student has a cell phone in his house, he or she is gonna be able to access and go back and review the session, or they can go and search for a homework sample so they can finish their homework for the next day. This also is gonna give a sense of importance for high school students because if they're working in order to improve the education of their younger peers, this will motivate the high school students to keep in high school and to keep learning in order to help their younger peers. So as I said before, we want to create a link, and we want to create a link where middle school students can go to and review the session of their homework. We also think that videos are better than applications because with videos they can access through any cell phone. Because if we create an app, you may already know that there is an app for iPhone, there is an app for BlackBerry. So we think that it's gonna be better if we just create a video. It's gonna be a standard mode, so basically anyone can access to it and with any kind of phone. So as I said before, the middle school students, once that they find themselves at home and they're having some trouble doing their homework or reviewing, they can easily go back and watch the video and take notes again. So this will improve education and will send more students to high school. And if we keep working with high school students, this will motivate high school students to keep working and to keep helping and to be a role model for the younger peers. So here are some benefits and costs that would include.
So as every project does, it has its benefits and its costs. So some of the benefits, e-learning is going to make education a little bit more convenient. They're going to have more access to it. The secondary school dropout rate is going to decrease dramatically. High school students are going to gain a sense of importance because they're going to be helping their younger peers. At the same time, not only that, they're going to be helping their teachers make these videos, and they're going to be teaching their younger peers on things such as STDs, unplanned pregnancies, and hygiene. At the same time, by using these phones, they're going to gain technological skills and self-confidence. And as any project has as well, it has its costs. We generated some numbers, and we're going to approximately need 160 phones that are worth about 100 per phone. We're going to provide students with these phones as well. We're going to need a few recording cameras so we can do these videos, and at least one computer with internet to upload these videos. And like any other school, we're going to need supplies to help these students do their research.
So the biggest question is, how will we raise money, funds for this project? Bring change to mind for better education. Let education for children in Ghana become an ongoing future. Bring change to mind can and will support that. So how will this work? We're going to propose for large businesses. We were thinking about grocery stores like Safeway, Giant, and Whole Foods. Say, for instance, you buy bread and a few other groceries, and it costs like $20 and 80 cents. We're going to take that 20 cents and make it to the round number, which is going to be $22, and that 20 cents will donate for the people in Ghana. So think for yourself, for every Safeway or Giant that get 1,000 customers and they donate 20 cents, each shop will make $200. So that is how we can raise funds.
So I just want to add to that. So basically, we want to start a new program in order to raise money for our project. So we want to work with these stores and grocery stores. So basically, they can ask their customers to donate their change, and in this way, we're gonna be people's gonna be giving for a good cause, and then they're gonna the store is gonna be able to do it faster. The next customer can move faster. So if they see that they will benefit from this, they will ask their customer if they want to donate their change, and that way we win, they win. They do it. They charge their other customer. They attend the next customer faster. So we think that this will really help us and help the stores that work with us. So, and then we also want to use advertisements through videos. As you know, if you upload any video to YouTube, you may allow your video to show some advertisement. In this way, every time that someone clicks on your video, you get some money, some revenues from the video. So basically, we also want to raise money this way. We want to allow our videos, or the videos that are created by the student, to be able to put advertisements on them. So we also want to ask companies to donate, and the way that the benefit that they will receive if they donate is that basically they can make videos as well, and ask our our students to fill out a survey. What do they think about the product, and also what do they think about the product, and whether they like. And because these are kids, we were thinking that we can use products such as dolls, clothes, shoes, and things like that, because there are things that the kids can describe or give their opinion on. So here's the impact and the rest.
We estimate that this impact will improve basic education. Secondly, healthcare awareness will increase, and that will have an impact on the decrease of disease spreading throughout the communities. Overall, this will improve the quality of life. Feasibility. Students will be exposed to learn about new technology, as well as moderate funding and technology training. We believe that once the students become self-sustained, this will enhance confidence along with determination. Scalability. We have concluded that the videos are more efficient than apps because they can be seen on almost any cell phone. Costs for ads and videos will pay for itself and be self-sustained. All these changes will have its chance to expand on high school and or communities.
Thank you.
Yes, excellent presentation. Quick question on how you're going to monitor the results of this effort. So are you going to be able to tell us how effective it's been and report back to your investors?
We want to work close with the teachers because they're the ones who are going to be also working with the high school students in order to record the videos. So we think that if we keep in touch with the teachers, I think that they can tell us whether the videos are improving education, or if they're not. We think that if teachers can let us know.
We will also have a kind of survey that they can go online and, just follow it by the survey.
You had a very compelling graph earlier, I think, that showed that the dropout rate for high school students was increasing, right, and going towards 50, 60%, something along those lines. And I know you said your stated goal, right, was to have 100% attendance. I'm curious to better understand what the main reasons are for students dropping out of high school, and how you feel that showing them educational videos will therefore increase their attendance in school.
Anyone? Hold on. I want to hear them first.
So the reasons why students drop out is because they don't get enough information about health, or like according maybe they're going through puberty. So with that, as we said in the slide, that can improve. We will have improve the education about health, so they can know what's happening, what their body is going to go through. So that's one of the reasons we can help them with.
There are also some of the other reasons that we found was that usually their schools are far away and sometimes they cannot make it. So we think that maybe if they miss one day, this is not going to affect them that much. So because they can go online and watch the video, try to do some homework. So this will improve. It will make it more convenient for them to basically watch one class that they miss if they go online. So, and also, as she was saying before, that we can health education is another problem that they drop out. So that was one of our goals as well. We want to make videos in order to help these kids, or at least help the high school students to realize of the issues that it brings. And if working with a teacher, I guess it will improve their education on health issues such as STDs and pregnancy and all these other issues affecting them.
Another issue is nutrition. If you don't get the right nutrition eating breakfast, you're going to lose concentration, so you can't focus. So with bring change to mind will help with that. Like we said, that they're going to donate those money for school supplies, for the phones, and the extra will also go into give them 1 meal per day for each kid to help them, their nutrition level.
Any other questions?
Did you do a comparative analysis of any countries with similar problems and how they may have worked to help raise their rates in attending school?
Actually, we did not compare any other country to Ghana. No, we did not compare any other country.
I think Nigeria had a similar problem, and just out of my that I've read so far, is that they actually helped improving kids in education by donation companies, but sometimes that is not a really effective way. That's just something that I saw when I did some research.
Okay. My last question also dealing with research. There are a lot of programs that are currently out here that do teach courses. Have you thought about maybe things along the lines of maybe translating them, having those programs translated so that you already have curriculums available that you could use? So just maybe getting those curriculums donated and translated as a way to cut costs?
Yeah, that would make it easier and cheaper, I think. So maybe we can integrate and work with other organizations that already had the videos here. So that's a good idea. Thank you. Any other question from the students? No? Thank you.
Thank you very much. The next team will be up in a moment. They will be talking about education as well in Ghana.
All right, hello everyone. Hello to the people of Accenture, as well as you guys and everyone else here in MCTV. My name is Colin Nygren Castles, and
Jennifer Hutman.
I'm Daphne Compere.
And I'm William Wiles.
And as our professor said, we are also tackling education. So, yeah, the best way we thought we can benefit Ghana is through education, and that is a bit of a broad term, and there's many possibilities, so many topics we could do with it. And we actually did start off with a completely different topic than this. But after reworking the issue tree so many times based on the input you guys have given us, we found that the best way to tackle education is through teacher staffing and training.
So the first thing we thought that we would want to tackle would be the teacher training. And there are about 2,500 teachers in Ghana. And out of that, about 1,000 of them aren't trained. So that's the group that we would want to start with and work with and kind of update their efficiency and train them. And as far as teacher staffing goes, the average number for the teacher-student ratio is 1 teacher for every 30 students, which really doesn't seem that crazy. But that's the average for the entire country. And if you look at the graph at the top, you can see that the Upper Eastern region, the average class size is 120 students per 1 teacher. So our hope is that our app will also increase the amount of teachers so that we can cut down on the ratio.
All right, so basically, not to go into like too much detail or because the other group went in and gave you a lot of numbers and gave you some details. We just realized that our plan is to increase the amount of trained teachers. The amount of trained teachers, it makes them a lot more efficient. You have more teachers, you can train a lot more students. So regardless of if you have students who are not showing up or students who are not doing well, if your teacher's a lot more efficient, they could teach a lot better, they could go through. We have a lot of different resources here that we haven't tapped into. They're free. We have companies like Brightstorm. You have ACDC Leadership. All these companies do videos and do things for free. They teach lessons online. But one of the main people that we were thinking about was Khan Academy. And just to give you guys an example of what one of the videos would look like, but at the same time giving you an example of what Khan Academy does, there's a small 1 minute video. So it should play. All right, so it's not going to play. But basically what Khan Academy is going to be, we're not going to exactly have to put all the research together. We're not sitting here going out and doing a lot of the legwork. A lot of the legwork is done. Like I said, we have resources that we haven't tapped into. Khan Academy has over 3,000 different videos on different subjects from science, math, and English. Brightstorm, like I mentioned before, they're a lot more science-oriented. ACDC Leadership does a lot of things like statistics and math. They do quick videos, and these are already teachers and professionals who are already in the industry or already teaching. We also have different, you go to different colleges and you can learn, you get free classes, and we're considering why not asking the professors or getting permission from them to record their classes? Why not get permission to do these things? We already have Montgomery College, who we are all attending. You know, we have all that. We could speak to the professors. We have University of Maryland. We have Bowie. We have all of these other different colleges. It doesn't have to be in our own local area, because in this day and age, you can communicate with anyone, anywhere, pretty much. But like I was saying, we have University of Maryland. We can use Montgomery College, and we could use the students to ask them for assistance in creating the app. But it's not necessarily having to create everything. It's more like organizing, putting all the information together, and categorizing it. So the only thing we're asking for in Ghana is necessarily a place to actually have all of this, or have like a headquarters almost, or like it doesn't necessarily have to be the University in Ghana or anything like that. It could be anywhere. We came up with our cost for everything is going to be less than $20,000. It sounds like, all right, that's really low, but if you're doing everyone who's traveling, $12,000 to get there. There's different programs where you can get housing per day with families, and it's about $3. Applying for a visa to stay there and get all the permits and things like that would be about $20. Smartphone, or you would ask, how would we supply the phones, or how would we supply all this? There's a company called Smartphones for Good. They take corporate phones and other different things, and they also help put together drives. So for different corporations, if you have a new phone that comes out and you trade your old phone in, they collect those old phones and actually send them out and donate them. What do they get in return? It's what they do. They're meeting their objective. They're meeting their goals. You know, MTN, if they could donate data, that would be great. In return, they get ad space. We could allow them to put advertisement up along with all the other companies. They get feedback and surveys to how their network is doing in certain areas. So if in certain areas they're not knowing exactly if they're getting like good service or not, they'll get a little bit more information. They also get loyalty. These teachers who are going to be using the data eventually will be using them already. So in return, they're doing well. They're going to go, well, we're going to continue using this company. I already get good service from them. I know them, and they're reliable. And it's also a potential increase in customers, because anyone else who sees the program goes, oh, you know, how are you getting the information? It's being donated by MTN. Again, the numbers that we put up here is based to 8 to 10 people, and that's just people going up there, helping out, volunteering their time. And we're thinking the rest of the capital can be raised through grants, fundraisers, alumni associations, and things like that. So pretty much all our benefits to Ghana.
Okay. The advantage our apps have for Ghana is like the teacher will be more, they have more knowledge. They will have more skill, and they will approach a new pedagogic for the student. And also they will be working in their education. They will have more time for the education. And also the level of teacher will be raising in the classroom. Their classroom efficiency will be more. Having more teacher in Ghana, that means we have more students. And more teacher, that means they have more time, more attention to keep the student in class. They don't have to drop out. And they will give their attention for their homework. And also we have more school and small class. They don't have to have a lot of students for one class. And also, since the teacher will be like connected in a global community because of the apps, they will be able to provide education, sexual education for the student, and they will help them to prevent some kind of disease like STDs and also how to prevent early pregnancies. For the course, most of the teachers live in rural section, and the transportation is really high for them. So they can stay home, study, and if they need question, they have some question, they can also chat with anyone in here or Ghana and have the answers. For Ghana, since we have more students and we have more teachers, the opportunity for real life will increase, and we will have more job opportunity. The economy in Ghana will grow, and the standard of living in Ghana will increase. Thank you. You have questions?
Have you considered how you're going to scale this program? I mean, I like the initial plan to use University of Maryland and other local schools, but how are you going to then take and make this maybe a nationwide program if we're going to really take this to scale in Ghana?
So like we were saying, everything starts off with about 8 to 10 people. Our original thought was to do about 5 people. We realized we might need some extra people. Some people might not be able to actually provide the full attention or have some people as backup. We're starting off hopefully with the Northeast region. It's like we were saying, it's the smallest region with the highest number of student to educator ratios. So if we could start off and show that it's doing well, and with the amount of money that it costs just to start it, which is pretty low, and then the money you're getting back in ad space, and the schools are getting in return a good name. They're actually, some professors, I think, if I remember correctly, do have to write papers, do research. They're getting information back. They're getting all of these things. So other schools might want to start participating. They might realize, all right, the same way you guys have entered our college and given us an opportunity, they realize, all right, we get an opportunity to go out and help someone else. We get to go out and actually improve someone else's life in return for real world experience. You're getting college credit for, depending on the class, and whatever agreements we can come up with.
Good, thank you.
What is your general timeline for implementation in this pilot in that one region?
The general timeline, it's going to take, just to start everything, we believe it could be anywhere from 6 months to a year. And that's just compiling the information, putting the information together, putting it in an organized manner where everything's accessible, makes sense, and you're not sitting there searching and doing tons of looking up. You have the information that's there, you have everything available. So putting it together is the part that's going to take the long time. It's also getting information from getting permission from Ghana, getting permission from the schools, getting educators who'd be willing to participate. So that's all communicating with them, and I think communicating is going to take a little bit longer than actually implementing the program, which would be quite simple once we have everything done. So 6 months to a year.
I do like the area that you're focusing on. I think you gave a compelling reason for why we wanted to focus on a specific region in Ghana. I do think your costs are a little bit low, but I'm not going to dwell on that. I actually have a question on how you're funding it. From what you talked about, it sounded like a lot of it is relying on donations, either in terms of time or in terms of people donating, actual resources like cash, charities and others that you're involving. You mentioned something that I thought was intriguing around using MTN and talking to them about new customers or ad space. I'm wondering if you guys explored that a little bit more. How can corporates benefit from this financially so that they can actually be an investor, right, rather than just a donor?
Well, like we were mentioning before, you could via ad space. So, for example, you get your video; it's a 30-second ad. You can charge people for that ad space. Using a company like MTN, like I said, they're getting in return, they're getting back a lot of feedback and information from customers, potential customers. But if another company wanted to enter, the same thing. They could compete with the other companies for ad space. So the more companies that you have, and well, before we can even start putting other companies in, once you get the program in place and it's all settled and fine, it's the same thing with TV. Everyone's going to compete for the amount of ad space. So other companies that are there are going to realize, all right, this is a good program. A lot of people are starting to see it. So it's not going to, with the first 1,000 teachers, it's not going to be, it's just those 1,000 people are going to be able to see it. But eventually, when you do have more educators and more people using it, a lot more companies are going to get to see it. So they're going to compete for that 30-second spot or ad or whatever we're going to put in there. So hopefully that breeds some sort of competition amongst local businesses or even companies that are here that want to participate.
Great.
Thank you. The next group, they're going to be discussing or presenting to you about distribution of medication, vital medication in Ghana.
All right. Hi, everyone. My name is Carissa. This is Jervon, and this is our Atara. And this is our presentation. So every year, thousands of people in Ghana die from a lack of access to medication. So as you can see in this chart, it's kind of broken down by the percentage of deaths caused by certain illnesses. And these illnesses are mostly treated or cured by medication. So the inaccessibility of medication is really caused by two major problems that we could see. And the first one was out-of-stock duration, and the second one was the unaffordability of medication. So, go to the next slide. Okay, so the stockout duration, 29.9 days is the length of stockout duration for public health facility dispensaries, and 26.3 days is the length of stockout duration for the warehouses supplying the public sector. So people can go 2 months plus without access to medication that could save their life. So it's a really big problem, and through researching it, we found out that the out-of-stock problem is really caused by a lack of communication between the medical distributors, the pharmacies, and the people in Ghana. So the other problem is the lack of affordability of medication in Ghana. So the average medicine costs from about 1 to 2 days of a person's salary for like a 30-day supply. And if you're living minimum wage, you're trying to make ends meet, you're trying to put food on your table, this is a huge expense to a lot of people, and it just is completely unaffordable. So our solution improves both the stockout duration. Hopefully we will be able to reduce the stockout duration completely, so you'll always have medicine in stock, and also will make medication much more accessible for the people in Ghana.
So in around 2008, Ms. Gladys Ashidi, who was the Deputy Ministry of Health of Ghana at the time, said that the biggest problem is there's no communication and no organization between the distributors, the dispensers, and the consumers in Ghana. So our proposed solution is that we automate the entire system of communication with those people, the distributors and the consumers and the pharmacies. This will start with the US drug companies that have any overstock problems with their medications. They can send a text or call the medical distribution centers in Ghana and tell them how they have this overstock problem and when to expect that overstock medication to arrive in Ghana. Then, once the distribution center gets that medication, they then send a text back to the drug company telling them they have the medication and it arrived at the correct time or it arrived late. Then, the medical distribution center will then send a text to the pharmacies in Ghana telling them when to expect the new medication at their pharmacies. Once the pharmacies in Ghana get that medication, they will then once again send a text back to the medical distribution centers to tell them whether or not the medication arrived on time or not. Once the pharmacies in Ghana have that medication, we want them to use the just-in-time inventory system for keeping the medication in stock, which is what Walmart uses. And that's when a product reaches a certain point on the shelf. Let's say you have around 600 medicines to cure epilepsy, and you've sold at least 100 of them. Then the pharmacies will know to send out another text to the medical distribution centers telling them that they will need a new stock because within the next couple days they might sell out of that medicine and they will need more medicine. Then once the pharmacies in Ghana have entered all the medicine into their inventory system, they'll then text the local community health workers so they can tell the citizens of the nearby village or town that there's medicine in the pharmacy. That way, the citizens don't have to waste nearly an entire day or half a day making a trek to a pharmacy and then finding that there's no medicine that they need. Then they've lost all this work time, and if you're living off of minimum wage, that's a big part of their salary.
Okay, so we did a breakdown of cost. This is a very, very low cost operation. So we basically broke it down into a startup cost and then a recurring cost. So the startup cost is just the cell phones pretty much for the medical distribution centers, the pharmacies, and the health workers in the villages. So we estimate around 20,000. I actually think that's kind of high. So also there will be a monthly cost because you have to keep the cell phones working. You have to pay for the plan. So the plan is $1.50 per month, and so that's going to be about $3,000 per month. But we think that the pharmacies will be, since they'll be always in stock, they'll be able to sell more medication, and they will be profiting from this. They will be doing better financially, and so they will be able to pay for their monthly cost for their cell phone use.
So the partners that we'll be working with are the MTN and Animus Fund. They'll provide the initial financial backing and the phones for the people of Ghana and the pharmacies and the healthcare workers. So then the Ministry of Health and the major drug companies in the US will be collaborating together this way to ensure that all the medicine that comes into Ghana is not expired or spoiled and it's all safe and for consumption for the citizens of Ghana. The pharmacies in Ghana will have to keep a careful stock of all the pharmaceuticals they receive. And the government healthcare workers' job will be to inform the citizens of Ghana when their medication is in stock so that way no one wastes any time making an unnecessary trip. And the drug companies in the US will have to keep up with all the orders made, and there'll be more because the system will be more organized.
Okay, so the short-term or immediate benefits, we're going to reduce the mortality in Ghana. Pretty simple. So we're going to improve the affordability of medication so people will be able to afford it, and they won't make those long treks to the pharmacy, to find out there's no medication. Also, we will improve the communication, which will hopefully reduce the amount of stockout duration in Ghana.
So for the long term, we're hoping that this will have a domino effect where people will have access to proper health care, and then children will be more healthy and they'll be able to attend school more often and become better working members of society. We're also hoping that for sustainability, that foreign companies, when they see this program implemented, will then want to use Ghana as a potential market for their products. And we're hoping that, and we know that this supply chain can be applied to other aspects of the Ghanaian economy, whether it's for distributing textbooks to the children of Ghana or other ways. And we're hoping that overall this can improve Ghana's HDI. And also when people see that, when people can make better trips to the pharmacy and there's actually medicine, people can get a wider view of what else they can do besides farming and other jobs. They can think, oh, maybe I can be a community health worker, or maybe I can work as a pharmacist. And we're hoping in the long term that this can start off as a more public sector and then transition to a private sector. And that's all. Any questions?
So this seems like a really interesting way to attack the supply chain. One of the things I was interested in is around the communication and training to the people who will be involved in this. I didn't see anything around in the process around that or in your cost base.
Training. Okay. Well, okay. So yeah, you would have to train. You would have to train the distributors. We're using basic SMS texting. So I don't think it would take any more than maybe a couple hours to train people. But yeah, when you distributed the phones, you would have to show, okay, this is how you use a cell phone, this is how you send a text message, this is how you receive a text message, and like here's what we expect of you to do. When you reach 6 items on the shelf, we, expect you to send a text message to the distributor saying, that you need this medication. So I think it would take very little time, but yeah, you would have to do that when you handed out the cell phones.
At most, we might have to have a person on staff that's sort of an IT person that can help them if any problems go wrong. But also, there are still plenty of people in Ghana who do have cell phones and who do have training of how to use a smartphone or a cell phone that is very basic, so they can also help out other people.
So at the beginning of the presentation, you mentioned that there's 2 big issues, right? One is the out-of-stock drugs, and the second is the affordability of those drugs. I like your supply chain solution, just as Ricarda said. I think you've put a relatively simple solution to a very complex problem, and I completely get how that will help with this 30-day stock-out issues. Tell me how this impacts the actual affordability of the drugs.
Yeah. So since So U.S. drug companies constantly have overstock problems, and so they just throw it out. They can't even donate as much as they have. So we're thinking if we can tap into those resources, and they're sending them to Ghana, to the Ghana distributors for no cost. Like the Ghana distributors don't have to pay anything, and so then they're able to sell it to the pharmacies for a very low cost, just pretty much their transportation and pretty much their cost, and make a small benefit off of it. And so we'll be able to reduce the cost a lot, and then the pharmacies sell them for even less to the people. So
you're saying one part of the solution is let's fix the supply chain stock out. The second part is let's negotiate with the big pharma companies and get them to give us their overstock essentially at a lower rate.
Yes.
And also one of the reasons why medication is so expensive is because of the out-of-stock duration. When you don't have something as often, it's a lot more expensive. Like just think of fruit and out-of-season fruit. Like it's a lot more expensive to get a strawberry right now because it's not the summertime. But so because they have such long out-of-stock durations, they have to make the medicine more expensive to sustain the pharmacies. But if medicine keeps on coming through, then the medicine will become cheaper for the citizens.
Thank you.
Well, we're going to move along one more group, and they, again, healthcare issue. They'll be discussing malnutrition, primarily looking at infants and pregnant mothers.
Good morning, everyone. My name is Lewis. This is Eric, Christian, and Miles. And today we're talking about malnutrition in Ghana and the problems with it and how we solve it.
Good morning, everyone. My name is Christian.
Miles, if you didn't hear before.
And basically, malnutrition in Ghana is a huge issue. Ghana has developed itself economically, socially, and politically in recent years. Even though it has advanced, a lot of issues remain, one of them being malnutrition. The problems with malnutrition affect greatest the northern area of the country, a rural area of a population of just a little bit over 1.8 million citizens. The populations that are mainly affected by this are infants and mothers. Within this area that remains the poorest in the country, about 70% of the people live with making less than $1 a day. 40% of the kids under the age of 5 in northern Ghana alone died because of malnutrition. In a recent study made in 2006, the ratio for mortality rate among these kids was 125 deaths per 1,000 live births. Malnutrition is mainly affected also in areas where education or mothers are not very well educated. And as you can see, again, it affects mainly kids under the age of 5, between the ages of 6 and under. Malnutrition itself is a really broad and complex problem. But our mainly focus is basically on helping mothers while they're pregnant. As mothers are pregnant, they're not able to feed themselves properly, making the embryos within themselves not to develop in the best way possible as they should, making the kid to lose and make them in disadvantage from the day that they're born. Also, mothers are not able to communicate themselves properly with physicians, and physicians themselves are not able to communicate themselves. Ghana has a huge issue with physicians. It only has 15 physicians for every 100,000 patients, compared to the United States that has 256 per 100,000, or Norway that has 313 per 100,000. The problems with infrastructure prevents the few physicians that they have to travel to the areas that they're needed, and also prevents for the food and the nutrients and the nutritions that they need to be distributed along with themselves. Our solution basically is the following.
So as Chris said before, obviously the complication in our issue tree from before, there's a lot of problems to attain to. So what we decided was, what do we think is best, and what one area of those complications can we focus on? And we decided that communication was probably the major one that we believe that we could have the best effect on. So as you can see on the slide behind me, this would be a picture of our creation of an app called the Healthy Heart app. And as you can see on the tabs on the left, what this applications would do would give you simple information about the categories. For instance, pregnancy. One of the main problems about some of the malnutrition with women who are pregnant is they simply don't know very basic right or wrong that people with countries with more higher education would know. So they would simply, if they download this app, they would simply touch the pregnancy tab, and information will come up of different sources of simple basic information of the do's and don'ts, and what signs to look for and not look for if problems arise. But our main thing about communication is the help us, help you part. As you can see on the top left, you would select that, then this next part would pop up. Simply a keyboard screen, just like on any smartphone would pop up. You would simply, the mother or the person who has the app would simply type in their problem, what's going on, report any problems with, let's say, vaccination or vaccinations or diseases that they see spreading within their family or around them, and they would submit it to us. We would take that data. And categorize it. If we move next to the business plan.
Before that, also one of the main things that the solution part would do also is that they will receive the breaking news updates, information as to when a disease outbreak occurs, because malnutrition also it's indirectly or directly connected to a lot of the issues that you will hear today, because diseases like malaria and HIV affect the strongest and more severely and more often areas where malnutrition is a huge issue. And also, the people will have the possibility to contact a physician, but we'll talk a little bit later about that.
At the current rates of malnutrition, Ghana can lose up to $41 billion of their potential lifetime earnings as a consequence of productivity loss caused by malnutrition issues.
But before we go on more with the revenues, we're going to talk about our costs and our allocation of the costs. As you can see in the pie chart, we broke it down into these categories of creating the app, U.S.-based employees who would work in collecting the data. Then there's the data charges, the Ghana-based employees who would be able to work more of an outreach and getting the app out there, office space, and then the hardware and software of the computers and the proper software to categorize all the data. And as you can see on the bottom, we got the value of $266,200. So we look at our business cycle of our revenues. We believe that we need to start with volunteer doctors and donations before we can really get on the ground running. Once we are able to start with those donations and get ourselves set up, we believe that our revenues are going to come in from the low cost of a $3 monthly subscription to the application, and then our major revenue stream would come from selling the data that we make. A lot of the times, there's a lot of great organizations out there that do a lot of great things away from us, going into other countries. And what we want to do is we want to reduce their cost by us selling our information, and therefore they don't need to gather all this information, and they don't waste resources when they go to certain areas. So they always have something to do. And as you can see, the breakdown of the revenue stream behind me.
Benefits that come from this are that issues by malnutrition will reduce by 1.5% within a year. Also, Ghana's economy should start showing improvement by the end of the second year. It will also educate pregnant mothers with prenatal and postnatal health. Also, it will it will help communication between patients and doctors amongst themselves. It will provide more job opportunities. It will increase doctor-to-patient ratio and lower mortality rate.
There are many different partners we came across to help us with fund our research. One is the GSMA, which is established the Development Fund in 2005, and its purpose is to help with the GMS technology and in developing countries. Next one is the MTN, which is a telecommunications company founded in 1994, and it's to provide help with our application. Another one is Animus Fund, and the foundation is used to help economic growth. And Magnus said that he will provide up to $2 million to help fund this research for developing countries in Africa.
We also found a partner with UNICEF, which is a member of the United Nations headquartered in New York. They focus mainly in helping mothers and childs around the world and with health issues and reducing the, poverty levels. We also have found the Catholic Relief Services, which is the international organization for humanitarian aids based in the United States. Their main focus is to provide relief in emergency situations and also help developing programs and in the developing world to help them improve their country and their health and other issues that they contain. And also we have the International Association of National Public Health Institutes, which is a member organization of government agencies around the world that provide, that their objective is to improve national disease prevention and responses to help improve the health issues, along with Johns Hopkins Hospital, which is one of the best renowned hospitals in the world. Basically, all these organizations are organizations that we're planning on selling our data and our information to, and they will be able to provide us with either volunteer doctors or other assistance that we need. So basically, for a conclusion, we ask, you know, we ask for your help on providing or giving us basically support in donations, resources, medicines, and other monetary contributions. We plan on incorporating Doctors Without Borders to our system and making a change in communicating better the education process between doctors and also between the mothers themselves. Many of the problems that we face today, you know, can be prevented, especially with our advanced technology. And we must act now, not later. Later may be too late. Thank you. Any questions?
Very good presentation. Question on just the literacy of the mother in using this application. It looked good for a U.S. market, but I'm worried about whether it will be usable in the Ghana environment.
Well, the research that we did found, like, you know, more like about 68% to 58% of the people in Ghana are literate themselves. Now, Johns Hopkins has a program which, you know, but mainly this is for the health portion, in which, you know, if a person is willing and, you know, like their intelligent level, basically they're accepted to the school, they will pay for the education, train them in the area that they need to be trained, and then they will send them back to their native country to help improve the health issues within that area. So basically, that would help a little bit on the portion for doctors.
To build on that, I see if we can go back to the allocation of our expenses. We believe that Ghana based employees is very important to spread the word and help the ease of learning how to use the application. Obviously, we made it as simple as possible, and we decided an app because of the amount of smartphones that are used in Ghana, and especially in that particular area. But yes, there definitely will be we will need some Ghana-based employees to help spread and simplify the use of the application.
Great, thank you.
So one thing I really like is that you've asked for money up front to basically set this up, but you have a very good forecast of how you're going to sustain this, right? Like, especially selling the data. So I think that's a unique aspect of what you guys have put together. I was a little bit surprised to see that the organizations to whom you're selling data are nonprofits, like Catholic Relief Services and Johns Hopkins and UNICEF. I'd be interested to get your thoughts on why sell the data to nonprofits versus private sector, and what type of data do you think they'd be willing to buy?
Well, our main objective in doing this is that those two corporations are one of the biggest nonprofits around the world. For example, just UNICEF revenues last year, you know, came close to almost $3 billion. And, you know, they are willing to help. You know, their main objective is helping others, and they do provide assistance to other starting, you know, companies or whatnot that are willing to help in the development world. And Catholic Relief Services, you know, is one of the biggest, well, it's like one of the biggest within the Catholic community, humanitarian aid companies. And we find that, you know, they already have a lot of programs running within Africa, which is one of the reasons why we also chose them. But they also would provide volunteers that would help, you know, in the long run, you know, to take food or proteins to the people in needed areas.
just to build on what he was saying, was one of the problems in the industry was communication, and the fact that sometimes these nonprofit organizations and the corporations that do go and help is the wasted resources. So we thought if we sell it at a low cost, because obviously we need to keep ourselves sustainable, if we sell our data to a low cost to the nonprofits that really do good in Ghana, this way we cut some of their losses with the idea of their wasted resources. This way they know exactly where to go and exactly what the problem is, as opposed to sending people and not exactly being sure. So we saw that if we sell at a low cost to bigger organizations like he said that do have a steady revenue stream, it wouldn't necessarily be taking away or hindering from their organization.
And also as to what the reports would include, they would basically, the reports that we will give them, we will have health information about the patient, vaccinations that they have received or vaccinations they need, outbreaks that have occurred within the area that from what the report they requested, and basically also the employees that we're going to have in Ghana, it won't be just for them to provide their, to basically give our application out, but also to give us feedback about the situations and the outbreaks of diseases and other situations.
Thank you very much. Well, we are going to add our voices to a way in which AIDS virus can be reduced. So the next group will be looking at the spread of HIV and ideas as to how they can reduce the spread within Ghana. Thank you.
Well, just quick introduction. I'm Ebony.
I'm Jonathan.
Shannon.
Tatiana.
And we are here to talk about how to reduce HIV, specifically among sex workers. So as you can see here in the chart, it basically shows that sex workers are among one of the highest groups that are distributing HIV right now. And we have a short story here from a actual sex worker in Ghana. She's speaking in, just a short video.
Ine nchito kule imene ndinalira kumwalira kwa mai anga ndi bambo anga anandisiya ndili ndi zaka 10 ndi ndinakhala kufika zaka 14 ndikuti imene ndikuvutikira chithandizo kulibe sikulu ndalekeza standard 8 ndikera kuntaona ndipanga chani chakudya chondisowa chovala chondisowa pamene ndinayamba chani ululu ndinapita kokayenzetsa nthawi imene ndinapita nditakayenzetsa ndinapezeka kuti sana ndipeze nakoka chirombo moti vanokandiyendeka chiyembekezo choti ndipiteso ndikayenzetse.
Now, if you pay close, the last thing that she mentioned was she went to go get tested for HIV. They didn't find anything, and she has to go back. So our main concern is how to make them want to come to get tested and how to show them that it's good. So right now, as you can see, the percentage, there's a high percentage of clients who refuse to use condoms with the sex workers, and being though they're in this business to make money, they're not going to reject it. The population right now in Ghana is about 25,241,998, and 260,000 are infected with HIV. And our main concern is that 25% of the sex workers are living with HIV right now. So our question is, how do we reduce the prevalence of HIV in Ghana? Which is meaning, how do we help the sex workers who are having unprotected sex with their clients and their partners, who are having sex with their regular partners? Now, the main area that we want to focus on are the gold mining areas, because that's where most of the money is being made. So that's where the sex workers are focusing on.
As you can see from the video and the photo here, the life of a sex worker is not necessarily easy. As a group, I'm sorry. Excuse me. As we all know, HIV and AIDS is not only an issue in Ghana, but around the world. But as a group, what we can do to help is by focusing on these small mining communities located in Ghana. One small step can lead to a big impact in the fight for HIV and AIDS. Our application will be placed in both the hands of the sex worker and the nurse. The sex worker will communicate with the nurse via SMS or text message, and they will set up appointments in which the sex worker would be able to come meet in a private location with the nurse to discuss to make sure that to discuss treatment and if they are infected, or discuss prevention options if they have not been found with HIV or AIDS. As you can see from this slide, this is just like a brief example of how our application will look like. Pretty much there's slides or tabs that the sex worker will be able to access, like talk to the nurse to arrange appointments. And as you can see here, we have an example of one of our educational services, which just displays symptoms of HIV and AIDS, like fever, chills, pretty much general flu symptoms, something that a sex worker will look out for if they feel as though they might, came in contact with the virus.
So our main revenue is coming from the advertisement. We'll have 10 paying ads per year, which will cost $25 per ad. Also, training of nurses will cost $45 per a nurse, and the application fee will be $250. So total revenue will be $4,300. We have a fixed cost, which is development of application on the phone, $25,000, and the operation and maintenance of the application $6,000, and the total fixed cost will be around $31,000. Yearly operating cost will be using cell phones, which is $600. PDA for collecting data, $25,000, and we are asking about for $34,000 to fund our project. So to fund our project, we will have private sector, government, and donations. So private sector, MTN, which will provide subscriptions for the phones. Danex, it's a pharmaceutical company which will provide medical tools for nurses. Nokia, Samsung will provide cell phones. Kiss and Fiesta, they distribute condoms. They will have an advertisements next to our application, as well as Aura Quick in-home HIV test company. And one more private sector company will be a firm, a mobile development firm, for example, Android developer. And that will be 76% of our funding. Public is the government. 18% of our funding will fund the training of nurses. And the initial funding launch of application will be 6%, which will come from Animus Fund.
So basically, we want to make clear that we're not trying to get the sex workers out of the sex industry. We just want them to, we really want to prevent the spread of HIV. So basically, we want to make sure that they understand that it's okay for them to, come to us with their issues and how they're feeling. when they use these when they use these our application, which is called Nurse Connect, they will be able to keep up with their status and gain knowledge on their treatment options and be able to know like where are the treatment centers are located. You'll be able to improve healthcare in all these different ways, and they'll be more willing and aware of how they impact the community. Basically, we want to have everything trickle down. So right now we're focusing on the sex workers, but the sex workers, they go to other communities. So we wanted just to make sure that everybody understands that it's starting here, but it trickles down.
In conclusion, we came up with the phrase, we brought upon the phrase live, love, laugh, because we want these women to know that they are strong and they are beautiful, and we know that HIV can bring you down. So we want to show them that they can come to us, they can talk to us, and we can educate them and we can help them to whereas though we know that they're not going to stop because they need the money to survive, but we just want to show them that it is a way to protect yourselves and there is a way to be safe in this environment. So, yeah, thank you. Questions? Many of the groups have mentioned ads, revenue from ads. What type of ads do you think would be most beneficial to these people outside of condoms? What type of companies or corporations or ads are you trying to get and run that you think would help the people of Ghana? Well, one ad especially would be condoms, because we want to show them as you can see in the pie chart, it stated that a lot of the sex workers aren't using condoms because they don't have them. But besides condoms, we also want to put up ads that will kind of show them that they can get out of sex work as well. So there are companies that go door to door to meet with sex workers to educate them and train them on maybe pottering or any other activity that they can do to put money in their pocket and to sway them away from the business. But we don't want to approach them as if right now we want to just stop you from having sex work, because again, sex work is illegal, so they're not willing and upfront about it.
I also wanted to mention we have our quick in-home HIV test, so we can advertise that for those who want to just get treatment at home. And basically condoms and pharmaceutical companies.
So I really like that you focused on a segment of the population that is often overlooked by the development sector. So I think that's admirable. At the same time, I know that this particular segment has a lot of stigma attached, right? So if you have HIV, especially in rural areas and mining areas that you mentioned, I'm curious as to what your approach is for the training, change management aspect of this. Like, what's the incentive for a sex worker to go to the hospitals or to use these applications or talk to the nurses when they know that there's a stigma attached and it might impact their work or their livelihood?
Well, one thing that we wanted to focus on was having areas that sex workers go that are just for sex workers, because they won't go if, say, it's a hospital that's treating other illnesses. They won't go because they don't want that information to be out there. So we kind of want them to know that this is private and we're here to help you. And I think the incentive for them to come is basically to live a longer life, to be happy. We want to show them that you can help yourself. There are ways to help yourself, and everybody doesn't need to know, what you're doing, but there is a way to go and get help for you.
Great.
Thank you. Montgomery County, as well as Montgomery College, has an alert system. The county, if there's an accident on the Beltway, they alert you. The college, if we're closed. Well, OJ and his group has an alert system for Ghana that would help with their healthcare issues. You may want to go back and check the post down at the other.
No, do a scan.
Okay, there we go.
Good morning, everyone. My name is Alexander Fauché, and these are my group members, OJ, Fatima, Paul, and Franny. Now, we have all heard all the disparities affecting Ghana today, and we have a solution called G-Alert System. And Fatima here is going to come and talk to you more about some of the important facts.
So the reality is that the hygiene standards remain lawfully low in Ghana because Ghana is facing high risk hygienic issues and behaviors such as open defecation, hand washing without soap, consumption of untreated water, and without good hygiene, 80% of the diseases in Ghana are mainly caused because of hygiene behaviors. And also without good hygiene, Ghanaians are vulnerable to many health diseases that not only undermine the quality of their lives, but can also lead to death prematurely. Secondly, 9 million of the population in Ghana do not have access to clean water. For that reason, 5,000 children die every day from contaminated water, and also because of poor sanitation and poor hygiene practices. So the most important fact is that 24.4 million of people in Ghana have cell phones, which is close to the population number. And we want to use these cell phones to provide hygiene information to this population. So our system is going to provide information that is related to hygiene practices as well as other health-related issues. So in order to have a healthy population, and people can be able to go to school and also be able to work.
Okay, so basically we decided to break things down as to what she said, just sanitary issues. Thousands and thousands of people are dying every year just because they don't have clean water. They don't know to boil it. They don't know what to do when they wash their hands. What is a proper hand washing? What type of soap to use? Stuff like that. Basically, what we decided to implement was that although half of it is an infrastructure issue, half of it is an education issue. What can we do? What can we as people delivering the message, how can we link up to these people? How can we send them information, knowledge to know what and what not to do. And since, as Fatima mentioned, 22 million people have cell phones in this country, how do we link up to that? I don't think you know, I mean, our professor mentioned at the beginning of our presentation that Montgomery College and the county itself has an alert system. A lot of us are part of it. Basically, if anything happens, if there's a class canceled, if something happens on campus, we get the message right away. It's something that doesn't require a super smartphone to use. It's something that is just basic text message, SMS text message. With this technology, we think we can actually push these alerts, whether they be just sanitary alerts, things like how do you wash your hands, how does this affect you, to more to basically health alerts on a statewide level, where basically if there's an outbreak of malaria, if there's an outbreak here, we can contact those people, we can build a database with those people, and we can send them information. We can send, if you're near this area, your closest hospital's here. If you need help or anything like that, it's over there. Like, we can actually kind of segue into figuring all this out. I'm going to bring this over to OJ, who's going to talk about the implication of the system and all the partners that we're going to link with.
Thanks, Paul. These are the partners, government agencies and private sectors. The government agencies, the Ministry of Health in Ghana, the World Health Organization, and the Center for Disease Control. Now, they're all set out to reach the UN development goals. First is, these are the government organizations, then is the privates. Philips is partnered with Malawi Engineering. They're based in Accra, Ghana. That's the capital of Ghana. They are very committed to strengthening healthcare infrastructure in Ghana. And next is GSMA. We're going to use the GSM technology, such as SMS and MMS services, to reach citizens. And then there's MTN. MTN is the largest cell phone provider. It's like AT&T here or Verizon. We're going to use them as G-Alert's avenue to the people. Next is iHeed and Unilever. They have the same goals that we have. They have the same goals that we have. They have the same goals that we have. Sorry. They have the same goals we have, the same mission. iHeed is an Irish-based company. They are using cell phone technology to train community health workers to reach the people, to also help the disparities from diseases and community health workers. Now, they have a formula. We want to come into that formula with our G-Alert system to be able to help educate people and inform people, like Paul said. Unilever is a company that is in Ghana. They provide health. They are very particular about hygiene. They have products like soaps, and they're saying is if people take small everyday actions, this can add up to a big difference for Ghana, and we believe the same thing. Next, I'm going to talk about our implication. This is the process of implication for the G-Alert system. There are 3 steps. First, we like to compile a database, then input that database into GSM phone device platforms, and then mobilize our program. I'm going to go back to the first step. We want to use the World Health Organization statistics. We're going to use these organizations as resources. Ministry of Health, they have a broad idea of what's going on really in Ghana. And more importantly, we want to use local clinics, existing NGOs, doctors, because they're on the ground. They deal with these people on a regular basis. They know what's ailing them, what the problems are. And when we set our alert system, when these people go out, it's a better interaction between patient and community health worker. Next, we're going to input our database. Excuse me, before I go to the next step, the compilation of the database, we want to use Philips technology, Philips Electronics, to help with that compilation. And then we want to input that database into these phones with MTN. These are MTN services here. We want to have an MTN G-Alert service. And that database will be inputted into the phones before they go out for purchase. And people who do not have these phones have the ability to text 555 to 5551 to sign up for these G-Alert services. And then we're going to mobilize our program. Like I said earlier, IHEED is training the community health workers. When they go out there, they're going to talk to people about what we're doing, what G-Alert is all about, and how they can communicate back and forth. I'm going to leave it up to Franny to talk about the benefits and the cost and revenue stream.
Thanks, OJ. So a developing country can reach its full potential with the G-Alert system. For workers in Ghana, health is the ability to work and to provide a square meal for their families. For children in Ghana, health is the ability to play, to go to school, and to work towards a better future. With a more health-conscious nation, the G-Alert system will come in it'll do very good. And as OJ was saying earlier, IHEED is a company that created a formula, and with their formula, they plan on focusing on educating healthcare workers using mobile technology. We plan to be the cherry on top because we want to not only, educate, but also inform the citizens of Ghana. And now we'll talk about the cost. As you can see, our expenses are going to be pretty low. This is startup. Our assets will be our potential partners and their resources, and those will be pretty high, as you could see. Our investment will be Animus. There you go, Animus, and that's going to be our initial investor. And our loans, to start, it would be the government loans. And for revenue highlights, for our first year, we don't plan on making much. That's why our net profit is below zero. But we do expect to make something on our second year. And for that, we will look back at our first year and hope to scale up from MTN to other phone providers and also increase net profits. And for our third year, we aim to service not only one certain place in Ghana, but to other nations in sub-Saharan Africa.
In conclusion, with these learned methods of disease prevention, the spread of diseases will decrease, and a healthier population will rise, and therefore higher school attendance and a greater and more efficient workforce will be in place in Ghana. All in all, G-Alert system will equal to a prosperous Ghana.
Thank you guys for your time.
Yeah, very good presentation. Really like the simplicity of the solution. I think using SMS is certainly something that everybody through the population of Ghana can probably understand and will work well. Question is, have any other countries adopted a similar system that you can reference as one that is delivering on this model and has reduced any of the diseases we're talking about?
No. From our research, no. That's why we're taking the idea of Montgomery Alert and hoping to help, bring something new, beginning with Ghana, a small portion of Ghana, before we decide to scale up. So we have not looked at any other countries, or I did not read about any other country doing the same thing we're trying to do in Ghana.
Okay. And just as far as the database of what you would initially seed into the phone network, is that something you said you would compile from the government ministry, or is that something you would rely on from someone else?
Well, yes, we want to work with the agencies already in Ghana, local clinics, like I mentioned, that have a very good idea. A lot of NGOs, health NGOs, that have an idea of what's really ailing these people, so we know what kind of information to send out, whether it be seasonal alerts, maybe just before summer, give them temperature alerts, basic health and wellness tips on a weekly basis, washing your hands. If it's not using Unilever sells soaps, use Unilever soaps. Or if you can't even use the water, the dirty water, you use hand sanitizers. So that's how we plan on compiling the data and knowing exactly what to get out to the people.
Great, thank you.
Yes, sir.
So I love any business plan that has profits in the second year. I mean, that's pretty significant to be able to turn that kind of profit that quickly. Can you talk a little bit about the revenues and where they're actually coming from? Who are you selling something to, and how much are they paying?
Well, the revenues, the idea was that Unilever, when we do send out these alerts, they're gonna have ads with them, okay? And when we get our revenue, the G-Alerts revenue is gonna come from the services we're providing. We want to give MTN and the government full access to this, I guess I should say, what's the word for it? To getting the information out, okay? They're gonna get that information out. We're gonna take that information, we're gonna take our, please,
Well,
I'm sorry.
Well, basically, just kind of to reemphasize what he was trying to get at, like when we say advertisements within it, when we send out the text, it's not only just clean your hands, use our partner's soap. That can be added within it. It's one of those things where, in order to even kind of get profit, to keep the cash flow growing, it does have to have that in it. And we think it may be subtle, but partners will still come to it. We'll have a database with a lot of numbers in it. That'll help it go forward.
So the revenues are primarily from private sector companies that are putting ads on the alerts.
Yes, and moving on from MTN to Vodafone and Tigo as we go along. They'll help share the revenue between yes.
Okay.
That's all I have. Any questions? Any other questions from the students, maybe?
Yeah.
Yeah, just one other question. As far as the implementation goes, will you go big bang into the whole country at one time, or is there a regional focus?
I think we should start. I think it should be a regional focus. I think regional focus makes more sense to kind of gauge and have an idea of how well this is going to work before we go any further.
Do you know what region might make sense? Did your research come up with a target region?
Well, the northern part of Ghana is the toughest part of Ghana, I should say. So we want to focus up there. Yes. Thanks. Any other questions? Thank you, guys.
That concludes our presentations, and we want to move into the latter part of the program. Just after this project started, a few students shared with me their feelings about the project and their experience. And two of them, Paula and OJ, would like to share with you how they feel about the project and their experience. Thank you. Ladies first.
Yes.
Dr. Sneezik, Dr. Summersall, Ms. Jessica Long, Mr. Roger Ford, Ms. Ricarda, Ganjam, Ms. Latisha Robinson, and of course, Professor Foster. On behalf of the class, I wanted to thank you all for the opportunity to allow us to take part on a global current event that positively impacts lives. While researching for this project, I have gained invaluable knowledge about the developing countries, not just Ghana, but Tanzania, Kenya, Turkey, India. This is making us all aware that there is still change that is necessary and that there's money out there for such development funds. Besides the opportunity given to us to make a difference with an idea, this project has given us all the experience to work together with a variety of different people to come up with a successful solution. It's this experience alone of working together for a common cause that has made us stronger and more prepared for the career world that we're all looking to delve in. Thank you.
Dean Schnizik, Dr. Summersall, and the whole Accenture staff. Thank you guys so much for this opportunity. This has been a growth process, particularly for me and my group. From the beginning stages when Ms. Long would come in, and just kind of help critique us, get us on the right path. This is real life. This is real life. This is what you guys do on a regular basis. We're in business class because we want to get an idea. And starting an intro to business, Professor Foster has done a great job getting us focused and getting you guys involved in our development. And I want to thank you guys so much on behalf of everybody here. And we hope to keep this going. This is not really, I wouldn't say regular at a community college. This is something you would do at a four-year school. But we're getting started now, and we believe this is a strong step towards our future. Thank you guys so much.
And now to conclude the program, we want to welcome Christian to say thank you.
Hello, everyone. I believe that all the members that presented today share the same thoughts when I say that we have the opportunity, the ability, and the resources to help others and help improve their lives and health. No matter how big or how small that help is, we all worked on our projects with the desire of making a change. And with the desire of helping move efforts forward towards a better Ghana. With that said, I would like to, in behalf of everyone here, I would like to extend gratitude to Dean Dr. Summersall, Mr. Roger Ford, Mrs. Jessica Long, Daniel Baker, to the judges, Latisha Roberson, Ricarda Ganjam, to the professors and students for allowing us, for attending today and allowing us, giving us this opportunity to share ideas with you. Thank you.
And I just want to add my voice to say thank you to my students. You've been great. It was challenging, hard work, but you did a great job. So I want to thank all of you. Give yourself a pat on the back. And to Accenture, I want to say thank you for this opportunity you've given to my students. Thanks, everyone, for coming. Have a great day. Oh, yes. My mistake. We have the final presentation for the overall winning team. Forgot that main part.
Well, I'd just like to say, first of all, thank you to everyone in the class, especially Dr. Foster and the executives here at Montgomery College. It's been very exciting for us, and I was extremely impressed to see the variety of cases, right? So everything from agriculture to sex workers, student education, teacher education, malnutrition, hygiene. The variety was fantastic, and you could just tell the amount of thought that you put into the cases, as well as the research and the heart in your presentation. So I think for us, I know that was very meaningful and extremely helpful for us to see the different ideas that you're bringing forward. So the results that we were just calculating, as you guys were, the final presentations or the final remarks, extremely close. So there's only a point separating like number 1 from number 2 and 3, which are tied. And overall, only like a 5 or 6 point spread. So just amazing job to everyone. But overall, the highest score goes to the malnutrition team, the one that was looking at infant and mother malnutrition. So congratulations to that team. And we have just little gift bags for you guys, but just a small token of our appreciation. So thank you very much.
Again, if you guys want to come up, we'll hand you your little prize. Congratulations, and again, I wanted to personally thank the leadership of Montgomery College, and as well as all the students for such a rewarding semester. I mean, this was as rewarding for our Accenture team as it was for you guys, so we really appreciate that opportunity. So congrats to each of you for that. And thank you very much. And thank you again. And thank you specifically to Professor Foster for this opportunity and for the class. So thanks again.
If I could just say something.
Mm-hmm.
I'd be remiss if I didn't say something now. The entire time I was listening, I was thinking, I could not have had a better early Christmas and birthday present. My birthday is 2 days after Christmas. And I was listening to your confidence, your poise. It was obvious that you've done research and that you were able to think on your feet. I also thought, what are you going to do next for the people who have done such an amazing amount of research and you're so passionate about your topic? Are you going to find a way to implement some of the ideas that you have, because they are well thought out ideas? Montgomery College is better because of its relationship with Accenture and the dedication of the people who came today. I know that when I first talked to Roger Ford last year during the spring, he said that he would find a way to work with Montgomery College more closely. So Ms. Long, Mr. Ford, your professor who has followed through on this for you, thank you all and have a wonderful holiday.